Hello, everyone, and welcome back to the Health Boardroom. I'm Ron, and I'm glad you're here today. In this third episode, we will decode the economics behind healthcare's transformation, from innovation and investment to operations and strategy. So, today we are exploring a question that sits at the center of every leadership table right now. How is AI changing the economics of healthcare delivery, from hospital operations to payer strategy? For decades, healthcare's cost structure has been rigid. Labor intensity, administrative complexity, and fragmented systems have made efficiency the hardest currency to earn. But we are entering a new economic era, one where AI isn't just optimizing workflows, it's rewriting the balance sheet of healthcare. So let's start where the cost burden has always been the heaviest: the clinical frontline. Documentation, coding, and billing, the invisible backbone of care delivery, have long consumed an extraordinary share of time and dollars. A clinician might spend up to half their day entering notes, updating records, and ensuring compliance. Indeed, it's valuable work, but not value creating work. And that's where AI is quietly changing the map. Ambient documentation tools are already lifting this burden, converting conversations into structured clinical notes, coded and ready for the EHR. So basically, what once took hours now takes only a few minutes. Hospitals that have adopted these systems are reporting not only productivity gains of 20 to 30%, but also margin recovery from higher throughput and faster claim submission. So AI hasn't just saved time, it has actually reduced the cost of care delivery itself. Now let's take a look at the coding as well. Traditionally, coding errors and delays can choke a hospital's cash flow. But AI-driven coding engines are now automating complex classifications, flagging anomalies, and ensuring compliance in real time. It's precision meeting speed. And in financial terms, it means fewer denials, faster reimbursement, and cleaner books. The economical ripple effect is massive. For every 1% reduction in coding errors, millions are recovered across a large system. This isn't just an efficiency story, it's a working capital story. And let's talk about billing as well, the next frontier. AI is now starting to automate everything from claims submission to reconciliation. We are talking about intelligent billing cycles that can detect missing data even before submission, verify payer eligibility instantly, and close the revenue loop faster than ever before. In certain pilot sites, this has reduced days in accounts receivable by nearly half. And that's not just a software upgrade, that's actually a structural cost shift. Because in healthcare economics, faster cash conversion equals stronger liquidity, and liquidity is what sustains innovation. Now let's step back a little and look globally. Right? In China and Saudi Arabia, AI-first hospitals have moved beyond pilots and into full-scale deployment. Facilities where documentation, triage, diagnostics, and even surgical prep are being managed by AI systems, supervised, not replaced by clinicians. Their goal is clear: deliver the same quality of care with a radically improved efficiency and consistency. And early data is telling, right? Administrative overhead has dropped by double digits. Clinical throughput has risen. Error rates are falling. These hospitals are essentially testing a new healthcare equation: care quality per dollar, and proving that automation can make high quality medicine economically sustainable. But yes, not without a debate, because as we move toward these AI driven models, one question looms large: where do clinicians fit? And I'll be honest, I don't believe in a machine led future of healthcare. AI should support clinicians and not replace them. It basically should amplify their judgment and not override it. If we remove humans from the loop, we may gain efficiency, but we'll definitely lose empathy, context, and trust. And trust is the real currency of healthcare economics. So, the most forward thinking organizations aren't asking, hey, how do we replace people? They're actually asking, how do we redeploy people to their highest value? When AI handles the documentation, clinicians can spend more time with patients. When coding and billing are automated, finance teams can actually focus on analytics and strategy. That's not job displacement, right? That's a role evaluation. So let's zoom out again to the system level. AI is driving three macroeconomic shifts in healthcare at this point of time. First one being labor efficiency, because by offloading a routine administrative work, AI changes the labor to output ratio, allowing systems to deliver more care with the same or even fewer resources. Second is capital reallocation, because savings from automation can be redirected towards innovation. Innovations like telehealth expansion, population health initiatives, and why not value-based contracting as well. And the third macroeconomic shift in healthcare that I foresee is data as an economic asset. So payers and providers are actually beginning to treat predictive data models as shared capital. Tools that can actually reduce waste, prevent readmissions, and improve ROI across the continuum of care. That's a new kind of healthcare economy, one built not just on volume, but on intelligence per dollar spent. But for this to work, leaders must stay anchored in purpose, because AI may optimize cost, but only humans can define value. Technology can calculate efficiency, but it cannot measure compassion. As we redesign healthcare's economic model, we have to protect its moral one. So here is the key takeaway. AI is no longer just a technology investment. It's an economic strategy. It's shifting how revenue is captured, how labor is used, and how value is defined. But its greatest potential lies not in automation, but in augmentation, empowering people to do more of what only humans can do: heal, connect, and lead. So thank you for joining me on this episode of the Health Boardroom. If you found this conversation insightful, please share it with a colleague or a healthcare leader exploring how AI is reshaping cost, care, and strategy. And please don't forget to subscribe, because next time we may bring a guest with us, someone who's on the front lines of building a smarter, more human-centered healthcare system and making their own contribution towards a better future of care. Until then, stay thoughtful, stay curious, and keep reimagining what healthcare can be. I am Ron, and this is the Health Boardroom.